Hello and good evening. I'm Melisa Idris. You're watching The Future is Female. This is the show where we find the extraordinary in every woman. October 10th marks World Mental Health Day, and this year it comes as we are trying to come to terms with how our lives have changed as a result of the pandemic. And it's really brought home the importance of mental health and mental well being. In some ways, the pandemic has helped raise further awareness of mental health conditions, and that has led to advocacy groups and mental health stakeholders pushing even more fiercely towards greater investment and greater access to mental health care for everyone, everywhere. Our guest on the show tonight is one of the many people working hard to ensure equitable mental health care in Malaysia. Dr. Chua Sook Ning is the founder of Relate Malaysia, which is a not-for-profit organization dedicated to the provision of mental health services, education, training, and advocacy since 2015. And she's a clinical psychologist, she's an international researcher, a passionate educator, and advocate on the issue of mental health. She's given many TEDx talks on this topic, and I recommend you look them up. They're great. You can find them online. And to top it off, she's also currently a visiting scholar at Harvard T.H. Chan School of Public Health. What an honor and a pleasure it is to talk to her today. Dr. Chua, thank you so much for joining me on the show. Welcome.
Thanks for having me. I mean, I would feel honored to talk to myself too.
that was quite
that
a
introduction.
glowing
Yeah, I was like, who is that woman? But
well,
yes, thanks for having me.
Well, I've been I'm really happy to chat to you today because as I mentioned in my intro, I mean this past 18 months has really been kind of pivotal in highlighting the importance of our mental well-being. But you've been working in mental health, advocating for better mental health care for much longer than that. And I wanted
Mhm.
to ask you what what makes you passionate about working in mental health care advocacy?
Um, that's a all of a sudden my brain froze, but it just because it's such a big question. I'm trying to figure out where to best tackle it. I think
Mm,
I've always been very curious about psychology, about trying to figure out why people act and think the way they do. So as a kid, I remember asking my mom a lot of the why questions, and she I think is the extraordinary woman in my life. Was very patient with all my many questions, which is I think very different from a lot of I think experience a lot of Asian children's experience. You know, like you
mm,
don't ask too many questions. Like why are you asking so many questions? But that was always me. It got me in trouble in school, but at home it was very much encouraged. And and I think as I grew older, mental illness is in my family, and it I think impacted my life in a way to see, even 20, 30 years ago that nobody really talked about it. There was very little knowledge about it, and there's so few places you could go for help, and so that I remember very distinctly at 15 wanting to be a clinical psychologist, and not because everybody was telling me their problems, but because I saw the impact of not getting help. That my
mm.
family member and my family, my family member that was affected, my family that didn't know what to do. Sort of the helplessness and
Right.
nowhere to go for help. And so I went to Canada to study with the intention of becoming a clinical psychologist. Along the way, I sort of and with the dream of wanting to come back and transform mental health in Malaysia. Along the way, I lost that dream and says, all I want to do is be famous and rich. But as you know, dreams often come back because I apparently I wasn't going to be famous and rich, and it was just I fortuitously, or I think encouraged by my parents to continue pursuing clinical psychology in the original passion.
That
Coming
that
back to
is
Malaysia,
that
yeah.
is so. I mean, just sorry to interrupt, but I find that so funny that you wanted to be famous and rich, and yet
I
here you
did.
are with a non-profit that focuses on ensuring equitable mental health care, and
Yeah,
which is quite different from
I
a life
know,
of,
I know.
celebrity or riches.
I have to admit to you, Melissa. So my first dream, and my family, if they watch the show, will nod in agreement. I actually wanted to be the psychologist for the stars.
Okay, a
Just
Dr.
well,
Phil, a Dr.
y-
Phil type person.
yeah. I
Okay.
mean, I was fascinated by like Hollywood celebrities, like what are they thinking and what are they doing. So anyway, but that wasn't the path God put me on. But so I think coming back and being trained as a clinical psychologist and um, having a view of like, okay, I know what to do. But it wasn't until I was depressed 2 years after I came back that I realized I've seen it sort of from the outside, and it's very different when you yourself are affected. You know, when you yourself are facing a mental illness, and all of a sudden, like all the knowledge and all the book learning is not permeating through your experience. You know, it was insufficient. Just because I know I should, that it's not my fault, doesn't mean I didn't feel like it was my fault. I really did believe it was my fault, or that I was
Right.
weak, or to be depressed, and what was
Well,
wrong with me. Yeah.
well, thank
So
you for sharing that you also struggled with mental health. Does that make you approach your work as a clinical psychologist differently? Does that give you a different perspective, more empathy
yeah,
because you know what it's like to also struggle?
I think it was very transformative. And it was the my first experience of what it means to internalize the public stigma, so it becomes self stigma, right? It was all the negative stereotypes about that society has about people with mental illness. I internalized it and I applied it to myself. And as I was recovering from my depression, I thought, if I have all this knowledge and yet it's so difficult for me to get help, I can only imagine, and I know where to get help, but I can only imagine this that the public is going to have it so much more difficult, you know. And it started very small. It just started of me. Relate started with me just wanting to say, hey, let's put out some information and let's improve mental health literacy, and then we give talks about that, and people come in and say, but now that I've learned, what do I do? And I said, oh shoot, yeah, what do you do? And I was like, okay, I guess we got to do more. And so it kept kind of building based on the need, but um, I just think that as time went by, it has grown beyond my imagination, and I'm happy for someone else to fill the niche. But the thing is, there's so much need. So
Can I
yeah.
ask you who does it serve? So Relate Malaysia, I mean, I'm just wondering, you said there's so much need, but
Yeah.
specifically, where is that need coming from, and who does in particular Relate Malaysia serve?
Well, we really focus on community. So we want to make it accessible to everyone. We were the first to do only online therapy. So we were like very well prepared for COVID-19 because our services has only been
You had the
online.
foresight
And we
to
had the foresight.
move
And
online.
part of it was because a lot of the resources were unequally distributed, right? It would be in sort of in only urban centers, but in the rural areas or in smaller cities, there were very, very few resources for mental health care. And doing it online meant that we could reach more people and more effectively. And we only picked certain types of interventions that has been shown to be effective. So I wanted to say, just because we want to see how affordable it could be, but how good it could be,
Right.
So I don't like the idea that we like, just because we're cheap doesn't mean we have to be lousy, so how could we find an optimal solution that we try to make it as affordable as possible but as effective as possible, so that people's first experience with mental health care is, as much as we can try, and we're really going to try, is going to be a positive one. We want to
Okay.
offer effective services, so that people can get well, that people don't have to keep coming back, and people can find a way to live in this very difficult world.
Okay, well, I really like that what you brought up about affordable and effective. And I want to talk to you about some of the interventions maybe in the conversation. But I want to come back to something that you mentioned earlier about the stigma. And you said, 30, 40 years ago, there was a lot of stigma. You yourself had to kind of deal with not internalizing that. I'm wondering whether even today, I mean, in the past few years, in particular, the mental health, awareness campaigns, you've seen
Yeah.
that, reaching the masses, particularly on social media as well. Is there still concern about stigma today? And, does that stop people from seeking help for mental health illness?
Oh yeah, for sure. I'm sure some people have more positive attitudes, so they might be stigmatizing less. But flash campaigns and one-off campaigns aren't actually effective. So a lot of research shows that one of the more effective ways, and this is what we have not seen, is that we need people to self-disclose, right? So often the mental health literacy campaigns is about someone saying, you know what, if you need help, you should go. But they're not saying, I need help, I should have gone, right? And I'm waiting. Come on, people. And that's really why I had to try to be famous. What
To bring
like
that
minor,
was
minor celebrity, but not rich, just minor celebrity, just because I couldn't find anyone who was willing to say that because of the stigma, right? People didn't want to risk um, their
okay.
position and status in their world, and a high profile person doesn't want to come forward and say, I am depressed, I was depressed, I sought help, I'm on medication.
Well, let's take for the record.
Yeah.
I in the spirit of self-disclosure, I am currently undergoing psychotherapy. I've sought help. I've had
Mm,
struggles with my mental health in the past, and I'm
yeah,
glad that I sought help. And I wish I did it sooner. I wish
yeah, yeah,
I made that. I reached out sooner, and
yeah.
I've been in psychotherapy for a few years now, and I see slow progress. And I do want to talk about that, but we've got to take a quick break, Dr. Chua. We'll come back and dive into the question of Malaysia's mental health care system in just a
Hmm.
couple of minutes. So stay tuned to The Future is Female. We will be right back.
Hmm.
Hi, welcome back to The Future's Female. I'm Melisa Idris, and I'm speaking to clinical psychologist and founder of Relate Malaysia, Dr. Chua Sook Ning. This is as we mark World Mental Health Day on October 10th. Of course, mental health, as you were speaking about earlier, is everything from emotional and psychological and social well-being. Governs how you think and feel and act. And I wanted to ask you, Dr. Chua, you talked a little bit about recovering from depression, getting well and recovering from mental health. And I wonder how we should be thinking about mental health. I mean, is it seen, if I were to make the comparison to say physical health, is it seen to be like a chronic illness where you learn to live with it, you manage the
Hmm.
flare-ups, you
Hmm.
manage the symptoms, or do you think of it as like an acute illness or temporary illness where you look to cure
Sure.
it, you look to recover from it,
Right, right.
get better from it? Well, how
Yeah.
should we be thinking about our mental health?
Well, just like many physical illnesses, there are many different kinds. So for some illnesses, for sure, it is quite chronic, and it's something that you have to learn to manage for the rest of your life. And for some that actually for quite a number, it's recovery is possible to the point, and I don't mean recovery means as the absence of symptoms, um, but learning to live with the symptoms and learning to figure out how to reach your potential despite the symptoms, right?
Mm.
For some, with there are clear cut or as clear as possible, categorizations, right? With depression, if you don't have, you're not feeling low every day, you can find pleasure in activities, then yes, you don't have depression. But for some people, they have very chronic um, low mood, right? And they're gonna have to figure out how to live with it. And so it really depends on the illness, depends on the individual. But yeah, it's complex. So
Uh,
I would just say it's a continuum, and but you can live with it for sure.
okay, and so for those who are, who have been struggling with mental health, and it's a lot more common than we think. I'm just
Mhm,
wondering, because you talked about stigma as a barrier to help seeking. But there
mhm,
are many other barriers, right? Cost is one of them. You talked about affordable and effective. And cost, I
mhm,
think, is a huge concern for people that stops people from seeking mental health
mhm,
care. Time, in
mhm.
particular, I don't have the time to go and seek therapy sessions or see a clinical psychologist. How do we think about these things, particularly in terms of correcting or having policy interventions to correct some of the imbalances in access to mental health care?
Oh, big question.
Yeah, let's break it down.
Let's break it down. Well, I think that sort of we look at privatization, and you can't actually expect private care to be cheap, because there's actually no limit on that. So if we think about then how universal care models work in the world, is just that there is a certain amount of subsidization that people can claim for, right? So the government would subsidize, let's say, X amount of dollars. And then in certain systems, they've encouraged private and public healthcare to sort of cap it at that number. So let's say if the government's going to subsidize $150, hospitals are then encouraged to cap cost at $150, right? You can go to private healthcare and they're going to charge 250, but then you're still going to be able to claim $150. So I think we can think
Mhm.
about subsidization. We can think about insurance companies. Insurance have started looking into covering mental health care coverage, but the mental health care coverage is still very restricted and very limited compared to physical health conditions.
Right.
It's like only such a small amount compared to actually how much premium you're asked to pay, right? It's
Yeah,
quite
and
a quite an increment. Yeah.
I have to say I don't think that many people look at that insurance clause or that insurance rider and wonder how much coverage of mental health care do I get
Mm-hmm.
versus say your
Right.
physical
Right.
coverage. Yeah.
Yeah. So cost is one, and training. The standard of care. So what
Oh.
kind of care are we offering, right? Are we going to say we're going to offer any sort of care? Are we going to offer evidence-based care? Are we going to say only some types of care are going to be subsidized and others not really? And where are we going to get the people from, right? So we know that there, and I think people are rightly confused. There's so many terms now. Like a counselor, psychiatrist, and clinical psychologist, and who do I talk to? And everyone is sort of is a fragmented healthcare system right now.
Are there
Right?
clear distinctions to the different terms? I have to admit, I'm
Yeah, that might
also
get me in trouble, but what? I'll
okay.
give it a shot. I'll give it a shot. I mean, historically, they actually come from quite different traditions, and so I'll cover that counselors actually come from a more um, positive view of saying like we are seeing people who are relatively healthy who are going through stressors, and we're going to help them cope with those stresses. So they're often not trained to deal with mental illness, which is actually clinical psychologists came about to deal with a lot of testing. They did IQ tests, so it came out of World War II when they wanted to see who were suitable to be for soldiers and who was not. And what's unique about clinical psychologists is that they do research and they do assessments and they focus on treatment. And then psychiatrists, right now, the way the field has evolved, focus on medication. So they're still sort of trained to do talk therapy or psychotherapy, but that has primarily become the area of clinical psychologists, right? And because the psychiatrists tend to focus on the medication piece. So you want meds? psychiatrist, you want to talk to someone when you're ill or not ill, you just want to talk, there's clinical psychologists. You want to talk to someone when you're pretty okay but not feeling great, counselor.
Okay. All right. Well, there you go. You
There you go, breaks down.
helped us define that well. Um, Coming back to the mental health interventions and in particular investment in Malaysia, I'm just wondering, all those people in the categories that you mentioned, do we have enough of mental people, professionals working in mental health care in Malaysia? Is that when you think about doctor to patient ratio
Right.
in Malaysia, do we
Yeah,
have?
so the doctor to patient ratio is about 1 to 100,000. So you tell me, do you think that's enough?
Oh,
Yeah,
okay.
yeah.
And in terms of equitable access, I can just imagine, rural areas may not have
Hmm.
access to mental health care professionals the way the
Right,
urban
right.
population might.
Yeah, and it's not just we have to think about accessibility, not just in terms of whether there's a workforce, but we have to also think about accessibility in terms of what kind of cultural and social barriers there are, right? So in the
Mm,
more uh, less urbanized area, there may be more stigma, or there might be more obstacles or barriers to seeking help, even when you want to, because people might think of you poorly. So there are sort of different there's societal, there's psychological, there's economic barriers that can impact access to mental health care.
there's been so much that's said about mental health during this pandemic, but as a clinical psychologist, have you seen the way not just the pandemic, but the lockdown, the subsequent easing of restrictions, that the uncertainty in between, the concerns about being affected by this virus, have you seen that kind of permeate in your the people that you see, the people that you talk to?
Well, for sure. I mean, obviously, I think every practice has seen an increase of people seeking help. But
Is that
is
a
that
good thing?
it's a great thing. What's less good is that the support for these systems have not increased, right? So, we're asked to like provide support and help the community, which is that's what we're here for. But burnout among mental health care professionals is very, very high, right? I mean, even as we say, okay, go if you need help, go call the crisis center. But who's helping the people in the crisis centers,
Mm,
right? They're humans too, and it's hard for them. So I think that just saying, okay, go seek help, but not thinking about how do we help the people that are being asked for. So that's what I have to do in my team. And so even within my team, I've seen burnout is higher. Some of my team members, my psychologists, are anxious or depressed. So, because that affects anyone, right?
right.
We know that depression and anxiety is so common, and just because you're a psychologist doesn't mean you're immune to it. So I
Oh,
think we really have
can I
to
ask
figure
you
that out.
what kind of support you would like to see?
Well, money, give us some money. We have to raise our own funds, and part of it. So that's definitely we need more funding.
Okay.
But and for us anyway, how I try to support my team is like, which is a hard decision for us to make, is that we have to say we're not accepting clients at the moment, because if
Okay.
we keep accepting clients, one, the wait list is growing, but our team, they don't get a break. And so I'm trying to balance, like my team's mental health and also the care and uh, that I'm committed to trying to provide. And if we want to try to provide the best care possible, we need to be in the best condition possible, right? So it's a tough call, and I'm still struggling
Put
with
put
that.
the
Yeah,
mask on yourself first, right?
put the mask on
Before.
yourself
Yeah.
first, right? You got to put the oxygen
Yeah.
mask on. Yeah.
Can I ask you in the minute or so that we have left? I mean, for the people watching today, what would you like the audience to take away from this conversation, particularly since you've been doing a lot of work around mental health literacy, mental health awareness? What would you like us to kind of walk away from this conversation with?
Um, that's so tough. I feel there's so many things, but I think maybe the
It's like
key. Yeah,
A
the
lifetime
key.
of work in 1 minute.
Yeah. Oh gosh. Something cliche. No, I think we I think the key thing is like we all have mental health and we're all gonna struggle. And I really like Harry Stack Sullivan, which is a sort of psychiatrist who's been very influential in my life, and he just says we all have problems in living, you know, and seeking help and learning to share your burdens with one another is a way to figuring out how to live this life of struggle. So I'm not a really optimistic person, and I'm the first person to tell you life is hard and we all have problems in living, and that's why we can all share it.
Well, what an absolute pleasure to speak to you, and I'm going to leave on that note. And
Thank you
thank
for
you
having me.
for for being on the show today. Really appreciate your time.
You're welcome.
That's all we have for you on this episode of The Future's Female. I will be back with you same time next week for another episode. Thank you so much for watching. Good night.